Okay, hello everyone, and welcome to our session on assisted living programs. Can everybody hear me? I hope so. I'm Elizabeth Davis, and I'm the executive director and founder of a nonprofit organization called the Brightside Family. We develop and provide affordable housing, affordable assisted living, and a variety of other support services for older adults living in Bergen County. In 2014, we were planning and about to start construction of our 62-unit HUD subsidized senior apartment building. And as we were kind of laying that out and thinking about the responsibility of operating such a building, I was mindful of a number of conversations I had with local housing providers who were really struggling with tenants who had aged in place, were no longer independent, but really didn't want to leave their home and community. Nor could they really afford most assisted living communities in Bergen County. Our assisted living community, which is called Brightside Manor, is really the only facility in Bergen County that will routinely accept direct admission of residents on Medicaid, and where our rates are affordable to low and moderate income older adults. So again, tenants living in subsidized senior housing who are low income, most traditional assisted living facilities were not an option. So for them, a lot of times leaving their apartment and community are incorporated within the New Jersey assisted living regulations. There's 3 types of assisted living facilities: comprehensive personal care homes and assisted living programs. We started up a program in 2015. It's called PALS, which stands for Portable Assisted Living Services. And it's an apt name because assisted living programs are basically portable assisted living communities. So the assisted living program, again, it's licensed by the Department of Health specifically to bring services into subsidized housing developments where there's concentrations of older adults who, again, have aged in place, are no longer independent, and need the comprehensive services that one receives within an assisted living facility. So assisted living program providers must provide medication administration, assistance with personal care, nursing oversight with nurses managing all of the usually complex needs of program participants, coordinating with healthcare providers, and monitoring and again managing any of the residents' healthcare needs. We provide assistance with meal preparation, laundry, housekeeping, I think I said that, and also social activities. So we need to make sure that the residents are engaged with one another with community-based resources, and have lively day of activities. The nurse is on call 24 hours a day, 7 days a week, and depending on the program and the number of participants and the care needs of the participants, staffing is usually on site in the building anywhere from 12 hours a day to 24 hours a day. It's really a wonderful and unique model, and I'm often asked, why are there not more of these programs? So for example, in all of New Jersey, I think there's only about 11 or 12 active programs, and our program, which is at 3 locations in Bergen County, we're in Westwood, in a 182-unit building, and in 2 buildings within Garfield Housing Authority, which together house 235 older adults. But we're the only provider in Bergen County. And the reason why there aren't more programs is because it is a challenging program to operate. And I'll speak quickly about some of the challenges that ALP providers face. One is you have to have an economy of scale. And I'm sorry, I'm in a room where the lights go off if I don't move around enough. So anyway, you must have an economy of scale. So you can bring, if we sometimes get calls from housing providers who have one or two tenants who really need an assisted living program, it doesn't make sense economically. It's impossible to bring a program in if there's only a couple of participants who need the program. You really need to have the potential to have at least 20 to 30 residents on the program. You can start obviously with a smaller number, but you need to know that you'll be able to gear up and have at least 20 or 30 participants. Starting up a program takes time and money. The certificate of need approval process takes at least 6 months, and there's a fee attached, which is about $7,500. And then the license application is also a process that takes some time, at least 3 to 6 months, and there's a fee of $1,500. A startup program has to develop all of their policies and procedures, staffing plans, all of the different forms and again processes for the residents, and all the while building relationships and trust within the building, so that residents will be willing and interested in signing up for the program. Housing providers have to embrace the idea of supporting tenants as they age in place. Many housing providers, are just accustomed to managing buildings and rent up processes and managing building systems, HVAC, and so on. They're not accustomed to even considering the complex and changing needs of older adult residents. And some housing providers that we've approached and talked to, can't wait for us to come into the building, while others say, no, this is independent housing, and if my tenants aren't independent, then they have to leave. The Medicaid system is not an easy system to work with. They have to apply while Medicaid will pay for an assisted living program in full, so that there's no out-of-pocket cost for a tenant. The tenant must qualify for Medicaid. Most tenants in subsidized housing qualify income-wise, but Medicaid will not allow more than $2,000 in assets. And so that's a deal breaker for many tenants who have some savings and don't want to give those savings up to enroll in the program. It's a complicated, time-consuming, sometimes overwhelming application process. And for the provider, up until very recently, the Medicaid reimbursement rate was only $67 a day, which, if anyone knows anything about providing, home care services or any kind of services for older adults, $67 a day doesn't come close to covering our costs. So, again, we're not providing a couple of hours of home care to a resident. We're providing, we have a staff which consists of RNs and LPNs and home health aides and medication aides and housekeeping staff, and we're in a building 12 to 24 hours a day. So $67 a day is very, very low. Fortunately, as of July 1st of this year, that reimbursement rate went up to $89.50, which is about a 25% increase and hugely helpful. And then finally, among our challenges is that the program itself is a well-kept secret. As I said, managed care organizations aren't familiar, housing providers don't understand the program and aren't aware, and even the Department of Health that licenses assisted living programs, within their department, there's a lot of confusion and lack of knowledge of the program and an understanding of the ways in which it is unique from a facility-based assisted living community, and even how from one housing development to another, the assisted living program is going to look very different. So depending on where you are, where the housing project is located, the assisted living program or what the building looks like, what kinds of common areas they have, the assisted living program really has to adapt to a lot of different types of communities. So those are some of the challenges. Opportunities, there are many opportunities, however. There's obviously an increasingly large number of older adults living in subsidized housing who have aged in place, who need this kind of program, and would really benefit and we're keeping these tenants from being pushed prematurely into very expensive, costly nursing homes. The average cost of assisted living, again, is beyond what most tenants in subsidized housing can afford. And so large numbers of tenants could potentially end up in nursing homes by default. And the assisted living program is starting to really be embraced by the state and by managed care organizations as a more economical and care level appropriate alternative. Again, home and community-based services are embracing the ALP. Reimbursement rates have gone up. Housing financing and funding programs are starting to require developers to build in programs such as ALPs into their plans. They're requiring that housing providers accept the fact that they're housing a somewhat vulnerable population. Tenants' needs are going to change, and again, they're requiring developers to be prepared for the changing needs. We were very fortunate when in the startup of our PALS program, in that we got some support from the Henry and Marilyn Taub Foundation, as well as another foundation, the Brookdale Foundation. And the Henry and Marilyn Taub Foundation provided funding, but they also provided a lot of support, and they were very mindful of the challenges that we were facing, but also of the value. They really looked and saw the impact that we were having on our tenants, our residents, participants, and to the housing providers in whose buildings we were operating. But again, they saw the challenges that we were facing, and so they actually funded a program whereby Capital Impact Partners got involved, and we did a sort of a in-depth business analysis of the program. What would it take for the program to be fiscally sound and viable? We looked at the Medicaid regulations. We looked at the regulatory environment and the Medicaid regulations. And that led to our sort of opening up the lines of communication with other providers, and realizing that as ALP program providers, we needed to band together and have a collective voice. And so I think I'd like to turn the platform over to Candace Robinson at this time with Capital Impact Partners to talk about the ALP Provider Coalition and the work that we've been doing, and the tremendous impact of the coalition.
Well, thanks, Elizabeth, and thank you all for your interest today in this topic. We always love to talk about the ALP model because we want to shout it from the rooftops every time we have a chance. It's one of those, as Elizabeth said, it is a best kept secret, and that's the reason why Capital Impact got involved. So my name is Candace Robinson. I serve as the Director of Healthy Communities for Capital Impact Partners. We are a member of the momentous Capital family of companies. And what that really means is that we're an impact investor. We're a CDFI, Community Development Financial Institution. We're interested in both building the capacity and capital of the built environment, so affordable housing, healthy communities, services, long-term care facilities, those kinds of things we're interested in. But we also know as an impact investor that it's not the building, right? It's the operations that go inside and the sustainability of those providers that provide the wonderful, like yourselves, who provide really good, deep, impactful programs inside. We've been, scholars of affordable assisted living since 1992 with some funding from Rob Wood Johnson Foundation. And we're the first starting with the Affordable Assisted Living residential facility. And then when we learned about the ALP model, we said, well, wait a minute, this is really an asset-based community development approach. And how, as we see the growth of home and community-based services in our communities and the push towards more innovative models, how can we also leverage our knowledge not only in the built environment and financing, but also our capacity building around small businesses and small business providers to really build sustainable networks of service providers to ensure that these models are really built upon a foundation that can be sustainable, can grow, can expand. We were also sad to see that the ALP product program was really only in like 8 communities across the entire state of New Jersey. And yet, I think in the last conversation, we found out there are 217,000 dual eligible individuals living in the state of New Jersey, which, that just provides a potential market. So what we had done with the with Taub Foundation was to really look at, well, how does this model work? And then how do we get it to expand? And we had a opportunity really to work with Elizabeth one-on-one, but then realized that this is really a collective group. This is a voice that all needed to be provided, and we're going to get kicked out in 3 minutes. I'm going to do as fast as I can. So anyway, we felt that the coalition here's a group of individuals with a program model that have been on the books with the state for over 20 years, but until 2019, none of them had really been in a room together. And so it's an opportunity to really start to have a collective voice through the assisted living model. And I hope that you're seeing our Padlet up. We also dropped the link in the chat, but we were able to really develop a lot of tools and opportunities and ways that the assisted living providers can communicate the model, but also try to expand and make that knowledge work. As Elizabeth said, we worked on the Medicaid reimbursement, getting that right sized to, really what does it take to be a cost of, care. We also have worked with Department of Health and really educating them on some regulatory changes, not necessarily to waive or make exemptions, but just to create clarity within the regulatory environment so that not only do the providers know what that, but also the licensing structure and the licensing teams also have the knowledge to be really successful at their work too. And so just that knowledge and education. So I'll stop there. I know we have about 2 minutes, and I want to give the opportunity. This is a table conversation that's not going to be very much of a conversation if I don't stop talking. So thank you so much, and let's open it up to the floor. I'm going to stop sharing just so that's a little less crazy. I'd like to actually know by a show of hands, and you can kind of do your little reaction hand of how many of you knew about the ALP model before you walked in this table today? About 2 or 3, yeah. So thank you. We're happy to educate you about this new model that you've not known about. So yay, thank you so much. How can we help provide you more information? What was it that you're looking for this conversation? Hi, Allison.
Hi, Candace, Elizabeth, thank you so much. That was a really enlightening presentation. I realized that we had an email chain maybe a month ago when I got introduced to Althea and the Age Friendly New Jersey Coalition, and I would love to understand who JCHA should speak to. We've got a senior public housing development with 360 units. And it seems like this NALP partnership is something we should be pursuing.
We'd be happy to have a conversation with you and Elizabeth and any of the providers. I think would be happy to talk to you not only about how to get started, but and I would also go to the Padlet. There's a primer that we developed that kind of not a how-to guide, but provides some context about how to get started. So that might be a good place to start. Elizabeth?
Right, and I think someone did reach out to us. Is this in Jersey City?
Yes, I'll send. I started sending an email and then I thought I would speak, but I'll send the email also.
Yeah, and we'd be happy to, to